All right, good Thursday afternoon. I'm Dr. Martha Buchanan with the Knox County Health Department, Health Officer and Director. You probably know that by now. Our moment of gratitude today is dedicated to the members of our vaccination team and Knox County IT. Because of their efforts, we were able to launch an online registration platform this morning that lets folks who qualify register for their first dose of COVID-19 vaccine in a simple and quick manner. In just about an hour, we filled 975 appointments for people who desperately need and want this vaccine because of the vulnerability or high-risk status. We know this is just the tip of the iceberg, and there are many of you out there who still want vaccine, and we will continue to put additional opportunities out there as we receive more vaccine. Please keep an eye on our website and social media platforms, as well as our press brief and these press briefings for announcements. We will not be sending out text reminders to everyone, but pay attention to our website, social media, and these press briefings to learn when we're going to be offering those opportunities for people to get vaccinated. As a note, the 975 appointments will be held next Friday at the Expo Center. They've been separated into blocks of time to reduce long wait times. And if you have an appointment, please show up around your appointment time. If you show up early, we're asking that you sit in your car to reduce the number of people in line. As a reminder, if you're coming, if you've signed up for an appointment, you need to bring necessary information of your eligibility, proof of age, like a driver's license, or maybe your work ID if you're getting vaccinated because of your work. And if you can print your email or keep your email confirmation of your appointment, that would be helpful too. You must wear a mask when you come to the vaccination appointments to protect your health and the health of those around you. The Knox County Health Department continues to vaccinate those who fall within the first priority groups. That includes healthcare workers, first responders, and those over 75 and older, among other groups. We have the full list of those who are eligible on our website, and then the Tennessee Department of Health also has a really nice little tool to determine your eligibility on their website. We want to be clear that these phases are set by the state and the federal government. Kchd does not set the requirements and will not be changing from what the state decides are the priorities across the state. We'll continue to follow the state plan, and if they make changes, we'll make changes, but we'll stay in step with the rest of the state regarding what phase we're vaccinating, what groups are in those phases. For a vaccine update, the Knox County Health Department just received over 5,200 doses of vaccine. So we've received nearly 10,000 doses since late December. So let me break that down before you get too excited, because some of those doses are already dedicated for second doses. Okay, so remember, we vaccinated a lot of people and they need a second dose. So 975 of those doses are first dose doses that will be given at the clinic next week. The rest are for second doses, and those clinics will be scheduled as well. So folks who've already gotten a dose of vaccine need their second dose, and we've received those doses. It's a lot of doses. Received those doses today, and we'll be reaching out in the near future to those folks to let them know when and where those clinics will be held. I believe most of those clinics are going to be held at the Expo Center. So to date, we've administered just Knox County Health Department 4,000 doses of vaccine, and that's first doses. This week, we've been vaccinating groups that fall into intellectually or developmentally disabled. And that's a high-risk group that health departments were charged with vaccinating. And for a lot of those groups, we went to where they live or to them to vaccinate them for lots of different reasons: difficulty in transportation, comfort level, and all of those other things. So these are clinics that take a little bit more time. It just takes a little more time to get these folks vaccinated. We're very happy to do it, but this week was a week of no big, large clinics, but some smaller clinics to get those very high-risk folks vaccinated. We also worked with some community partners to get some other folks who were 75 or older and other risk groups, in the 75 or older risk group, vaccinated as well. So really focusing on some folks that might otherwise have access to vaccine this past week. If we look at the statewide numbers of first dose vaccines, as of Monday, Knox County has vaccinated about 3% of our population with our first dose of vaccine. If you look at that map on the state website, you see everything from around 1% to around 6%. So we're kind of in the middle of all that. But if you do the math, that means about 14,000 people in Knox County have received their first dose of COVID-19 vaccine. So that's pretty good. That's a combination of people at long-term care, doses being administered by hospitals, and doses being administered by the Knox County Health Department. So currently, Knox County Health Department, the pharmacy partnerships with long-term care, and our hospitals are the primary vaccinators. That will not always be the case as we have more vaccine coming into the community, more vaccine reliably available. That vaccine will move into pharmacies, provider offices, and that's going to take some time, but we do anticipate that that will happen. And we look forward to when that happens because we know the more access points there are for vaccine, the more people will get vaccinated. And again, I just want to remind everybody, again, to be patient. We know that demand is going to outpace supply for a while. And that's not unique to Knox County. It's not unique to Tennessee. It's happening across the country. Demand is outpacing supply. And we look forward to the day when that's not so, but it's going to be a while before that happens. As we mentioned, while Kchd, I already said that part. Sorry, I went off script. So now we'll move on to the local situation. We have 281 new confirmed cases since yesterday's report, 4,754 active cases, 170 Knox County residents are currently hospitalized, and sadly we have 3 additional deaths to report today, raising our total to 386. And now we'll turn toward the benchmarks. As a reminder, all the data we're going to talk about today is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. Over this time period, we saw daily new cases climb back up over 300 per day, which is up from the previous reporting period. Because of this, we are representing this benchmark as red. It's important to note that we have seen a decrease over the past couple of days in this week regarding daily case updates. While this is encouraging and we hope the trends continue, we will have to wait and see whether that's true. So just a couple of days is not a trend. We need to see that sustained. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, over this time period, we continue to see this figure remain consistent with more than 10,000 tests conducted weekly. Regarding lab turnaround time, this remains stable at 3.5 at a 3.5 day average for the community. Because of this, we're representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. Based on our internal assessment of our capabilities and acknowledging the continued need to prioritize our case investigations and eliminate our contact tracing in order to support additional response operations, we are representing this benchmark as red. We want to remind everyone to take personal responsibility and quarantine themselves at the first sign of exposure. Do not wait to receive a call from public health to start taking action. Isolate yourself if you have symptoms or have been exposed, and start calling your close contacts to make them aware so they can begin quarantining. Additionally, if you've been tested, regardless of whether you have symptoms, you need to quarantine until you get your test results. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, there were flags detected for all categories. However, this past week, we have seen these numbers decrease slightly, which is encouraging and something we hope continues. After speaking with our hospital partners, they have recommended that the benchmark be represented as red. While the numbers look better than they have in recent weeks, we still must wait and see if that continues. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan the response together to best serve this community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. During this time period, we have seen 58 deaths associated with COVID-19, which is an average of 4 deaths per day. This is just slightly down from what we reported last week. The information available leads us to continue to represent this benchmark as written. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Wednesday, our 14-day trend line showed 64 new cases per 100,000. And our 7-day trend line shows 68 new cases per 100,000, which is up slightly from last week. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 22.4%. Again, that continues to be quite high, leading us to recommend that because of the level of disease burden in our community, that we all treat ourselves and each other as though we might have COVID, therefore protecting each other from getting COVID. I'll now open it up for questions.
All right, questions for today. A couple already inputted in here. The first one we have is from Alan Sims with Inside Knoxville. State testing levels have not consistently returned to pre-holiday levels. At last night's Board of Health meeting, I understood you to say our county numbers have stabilized. Are we testing as many people as we were in the lead up to the holidays when our case numbers were so high?
We actually are not, because right before the holidays and during the holiday period, our testing numbers really went up quite a bit. And we believe that was because people were traveling for the holidays and getting tested before they travel. So we have not seen a return to those levels. We've seen a return to a level that we consider acceptable for our community of about 10,000 tests per week performed by all test providers, including the health department. So I don't anticipate until there's another big travel season us having that level of testing again in the near future.
From Grace with WBIR, what is it like for you to witness bars violating the Board of Health's orders again and again? What message does that send to your team?
Well, first of all, I don't witness that because I'm usually at home, but hearing about it, it's discouraging. It's discouraging to my team. It's discouraging to the Board of Health. It's discouraging to me. Again, people asked this last week, I believe, and it's disappointing to know that we have business people and people who own businesses in our community who choose to ignore health guidelines and choose to not take a consideration for the health of our community and the risk that they're putting others at by remaining open.
Grace had another question asking about receiving additional vaccine, which I believe Dr. B answered the initial talking points. If you've got a follow-up question, Grace, you can go ahead and submit that. From David with WVLT, has the health department had to dispose of any doses of vaccines? If so, why?
So we have not. We have not had to waste any vaccine. We did, and I just want to clarify, there was one time when there was a malfunction of the syringe, which is something that's happened with the syringes that were initially sent with the vaccine, where the hub of the syringe and the needle came apart, and that dose did not get given. That was the only time we've had to waste a dose. That was unfortunate. It was something experienced by many others who received similar products. We've since adjusted our process so that doesn't happen anymore, and we have not had to waste a dose because we didn't have an arm to put it in.
From Alexandra with the Daily Beacon, thousands of students are returning to a county that had some of the highest case counts in the nation. Basically, what should they be aware of, and how should students prevent this happening again?
Well, students should prevent this happening again, just like every other citizen in Knox County needs to help reduce our risk by practicing the 5 core actions. And now we've talked about saying 6 core actions: get vaccinated when you can. So social distancing, wearing a mask, washing your hands, not going out when you're sick, avoiding crowds, and cleaning surfaces regularly. Those are the things that people need to be doing and continue to do to reduce risk to themselves and others. And if they don't do that, we're just going to see our numbers go back up.
From David with WBLT, when does KCHD think they will be able to move into phase 1B of the vaccine plan in Knox County?
That's a great question. You know, it depends. So much of that depends on things that are totally out of our control. One depends on vaccine supply. Again, not in our control, federal and state control. The other is vaccine uptake. And also across the states, health departments and regions and counties are trying to kind of stay pretty close to each other as far as phases. The state is asking us to coordinate with each other and stay in similar or close to the same phases as the other counties around us. And so that's another, so it kind of depends on how quickly the whole state moves forward. So there are a lot of things that are that we can't predict. And so I really can't really say when I think we'll do that, because we don't have a reliable supply of vaccine coming in. We don't know how much vaccine we're going to get on a regular basis. So it's hard for us to control for that.
Also from David with WBLT, today there was a large jump of Knox County students quarantined. What concerns do you have about current cases in schools and what caused the jump?
You'd have to ask the schools about that, or I don't have any details, and we don't talk about details of cases. So I'm sure that the school team, I'm sure they had cases and took appropriate steps to reduce risk for students and teachers.
From Grace with WBIR, at the first clinic, you told us that the age groups under the current plan would start on certain dates, regardless of the current phases. Is that still your understanding? And if so, when would 65 and up qualify in Knox County, assuming no changes?
So great question. So guidance on the phases has varied and changed over time. Right now, we will just wait for when the state tells us to move to the next age group. And so, you know, that if you look at their website, I actually think that even their timeline has changed a little bit. So that'll be dependent on what the state recommends and how they see. So, you know, they can see the whole picture of the state and see, you know, how many people over the age of 75, what percentage of that population has been vaccinated. And whenever they feel that it's appropriate for us to move to that next phase, we will certainly do that.
From Alexandra with the Daily Beacon, have any doses been left over at the end of a vaccination day? And is there a waiting list where residents can sign up to be notified if there are leftover vaccines?
We are not at this time maintaining a waiting list. We do occasionally have doses left over. And what we do at that time is if somebody's worked the clinic and hasn't been vaccinated, we offer vaccine to them. We also are maintaining contacts with groups that serve people or are employers even of people in those groups. So first responders, medical providers, people who work with older folks. And we actually start making phone calls and say, hey, if you have some staff members who haven't been vaccinated, they can get here in an hour or less, send them over and we'll vaccinate them. That's how we make sure we don't waste doses. And also, you know, so managing vaccine is not new to us. We do school-located vaccination clinics every year. And we waste very little vaccine during those clinics. And we vaccinate, I don't know, I can't remember the number anymore, thousands of students. And so my staff, our team is very good at managing vaccine. And so sometimes the doses, depending on the guidelines for that particular vaccine, can just be kept to till the next clinic. So sometimes there are doses that we have there, they stay in refrigeration, they come back and get put in refrigeration, and we use them the next time we have a clinic. So it's very few vaccine doses that we actually have to administer once we're done. So it's like, you know, it's always a low number. And we definitely, our goal, and they understand our goal, and they believe in the goal of not wasting a dose because it's such a precious commodity.
From Jeff with WATE, did public concern about the first vaccination clinic influence the change to require reserved spots? And why were reservations not utilized during the first clinic?
So the first clinic was done kind of really quickly, and we didn't have a reservation system to do that. Just to give you perspective, building the reservation system that we used this morning has taken all week and part of last week, actually. It started last week over the weekend and the rest of this week. because what we did not want to put something out that was going to just crash. We didn't want to put something out that wasn't going to work. We didn't want to put something out. So we were meticulous about developing that system, and thanks to IT and our team here, I'm very proud of what we put out. So it just takes a lot of time to get those things right and get them put together. So that's one reason. The other reason was we had some doses. They added the 75 and older group. We didn't have anything planned for them. Our team said, hey, we need to focus on this group. We need to do what we can. We put together a clinic really fast and, did that kind of y'all come, and people waited in line for quite some time. Remind you that it was their choice to come and wait in line. We're very clear that that was not going to be the only opportunity to get a vaccine. And yeah, we listened to our community, and we heeded their input. It's also, it's a little less chaotic to have appointments for us as well on the other side. So it's less chaotic for the people going and less chaotic for our team who's working the clinic to have appointments. So moving to appointments kind of smooths things out a little bit. So yes, we listened to public feedback. I won't eliminate that we would have another big clinic where we don't make appointments, but this went so smoothly, we may continue to make appointments. We'll see how next Friday goes.
From Grace with WBIR, another waiting list question. She's asking if there will be a waiting list in case no one shows next Friday. How will that work? If so, I think you spoke to that when you answered the previous question. But Grace, if you have any follow-ups, please feel free to submit them. From Jeff with WATE, will people without internet access still be able to get vaccine appointments? Will they be crowded out with the web reservation system going so fast?
So if you read the press release, there were two ways for people to get vaccination appointments. They could call our 215-5555 number. We hope that will be transitioning to a different number in the near future. So we're working on a plan to use a different number to allow people to call that number to get appointments. And then they could also go on the web and get an appointment. And we actually got feedback from somebody who said they were able to go on and get an appointment for their 90-year-old mother or father. Can't remember which, but folks certainly were able to access that, and we were happy with that. So if somebody calls in, what happens is the operator just walks them through it. They do it for them, and it's simple. Ideally, we'd rather people go to that website. It's a little easier. It's one less step for our staff, and it's faster for the person. So we think that combination is going to work well, and we're hopeful that we can continue moving forward with that.
Also from Jeff with WATE, the Federal Department of Health and Human Services isn't holding back shots for second doses. Why is Kchd holding on to them? We're not holding on to second doses. We received a shipment to give us second doses, and we will have those clinics in the near future. The state of Tennessee, actually, I think federal government sends the state of Tennessee and then to us. That may change. That's the system that's in place right now to guarantee. So we get a shipment, we give all those first doses, then we get another shipment designated for second doses, and we give those. If the guidance changes and they say all the shipments are first doses, all the shipments will be first doses. All right, any further questions, please go ahead and submit them now. From Jeff with WATE, at future vaccination clinics, will there be a security plan in place early, like Knoxville police presence on site before the doors open? We always have a security plan, and we almost always have law enforcement present whenever we do a clinic. All right, any further questions, please go ahead and submit them. One more from Jeff. He says, we've been told that vaccine shipments are expected to grow in the weeks ahead. When is our next shipment coming? And do you have any idea how much or when those shipments will accelerate or increase in size? We have been told that we will get shipments weekly. We don't know exactly how much will be in each of those shipments, and we don't know when we'll get a reliable, regular schedule of doses so that we know how many doses we're getting each week. So that makes planning very challenging. But that's actually the federal government. I know what they're saying publicly, but what's happening practically is the federal government is telling the states, you get this many doses on, I think that's Wednesday or Thursday. This is how many doses Tennessee gets. The state then looks across the state based on population and also based on risk. There's some counties that have a higher vulnerability scale.
And then they allocate doses from the state level, and then those doses are given out. And health departments and hospitals ask for the doses that they want to continue doing. And the state then has to decide how much of those requests get filled. So it's a complicated system. And I know that publicly the federal government is saying they're not holding back doses and all of that, but actually practically what's happening is that's what's happening right now. So that's why it's a little bit hard to plan, because we don't know what we're getting each week, and the state doesn't even know what we're getting each week.
From Grace with WBIR, what's your message to those who haven't been able to get a vaccine yet?
Please be patient and continue to practice the 5 core actions. And if you've been vaccinated, continue to practice the 5 core actions. That's what's going to protect our community. This is not the time to say, oh, vaccine's here. I don't have to wear a mask. I don't have to socially distance. I don't have to limit my interactions. This is a time to be really, really intentional about that. Our numbers have been really high. We've seen a little bit of decrease. If we're going to see that continue, everybody has to continue to practice the 5 core actions, including those who've been vaccinated. And the other word for this will be patience. And we like to get what we want when we want it, and trust that we are getting those first doses out there and administering them as quickly as we can, as our other community partners, the hospitals and the pharmacies. And our goal is to get as many people vaccinated as quickly as we can. It's going to look different in different counties. And so it depends on the systems and the populations. That makes a big difference in how quickly a population gets vaccinated.
All right, last call. Any further questions? All right, not seeing any other questions come in. So thank you all for your time, and we will see you again next week. Hope you have a good and safe weekend.